Thanks for checking out Cork. I'm David Lindgren, Director of Sales for Cork Medical. You're probably here because, like many people, you are looking for a new provider of negative pressure wound therapy. We were one of those people as well. As a distributor, we worked with many different manufacturers to deliver negative pressure to the marketplace. And one of the things that we found was those products just didn't meet the clinician's needs. They weren't giving the outcomes that you expected. And so we began manufacturing our own negative pressure device. And now we go direct to market with it. We're one of a very few select companies in the country that go direct to market with their own negative pressure device. And that gives us a key level of accountability. An ability to make sure that our product lives up to the expectations that the clinicians demand. At the same time, one of the key components to what we do at Cork Medical is provide an increased level of service, support, training, and education. And many times that's the reason why clinicians are choosing to work with Cork, and then they discover the outcomes that they get are as good, if not better, than what they've been getting full time.
I always use the competition, but I also had patients that needed extra assistance, financial assistance. I turned to Cork Medical within 2 hours of a patient's discharge, and not only were they able to help the patient financially, but they delivered the pump 30 minutes before the discharge. I was impressed, but I'm not that easily impressed, so I kept an eye on the patient through home care, and wouldn't you know it, the patient was healing. The pump was doing equally as well as the competition, and the patients were being seen as real people.
Where we are now is we've got a fantastic product that delivers outstanding outcomes. And as we see with many of our wound care partners, they choose to use us because of service, support, training, and education. We simply make it easier for them to work and get negative pressure for their patients. But at the same time, it's not just about service, support, training, and education. It's got to be about outcomes, right? And that's what our wound care nurses resoundingly give us the feedback on. They get the outcomes that they're looking for with the Cork Medical device.
Next wound care nurse I spoke with, she said the proof is in the pudding. She said the outcomes are outstanding with our Nissus pump. They've taken very large wounds and applied negative pressure to it, and those wounds have healed. And obviously that's a great example of how our pump can really change people's lives.
You may have tried other negative pressure devices in the past and been left unsatisfied or with substandard outcomes to what you were used to. But with Cork, you can have the outcomes and get the service and support that you're looking for. We look at it like we provide a service that happens to provide a product. Now that product has to be a world-class product that produces outstanding outcomes. But it does start for us with that service. What do I mean by service?
The service is where we go above and beyond and really differentiate ourselves. It's the continuum of care. From the point that we get in touch with the patient, we're making sure that all of their questions are answered. We're giving them resources to who they can contact. They get my personal cell phone number. They get our clinical nurse's personal cell phone number, and we're reaching out to them, following up, checking in to see how they're doing. Are they progressing? Do they have any questions? We make sure that we get in contact with everyone in that patient's healing process to ensure they know who to reach out to if something were to arise, a question, issue, concern. We at Cork strive to make sure that the patient and the nurse are never left in the dark, and that we're there to help them every step of the way.
We provide those types of services and support to you and to your patients to help make sure that that healing process takes place. And at the same time, we're producing those outstanding outcomes. As you'll see in some of these testimonials and from the feedback we receive from our wound care nurses, you'll see that you can have both. You can have the service and support that you demand, as well as the outcomes that you absolutely need.
On a Thursday afternoon, we found out later after talking to them that they had a trip planned for 3 weeks in Florida as a celebratory trip for all the service she had done in her community as a teacher. When I heard that we weren't able to set up home health because of this trip, I immediately called our clinical nurse, and her and I brainstormed a way for them to be able to go on the trip and for her to still get the plan of care. We were fortunate enough that the patient's husband had EMT experience and was able to quickly pick up on how to change dressings. On 9 p.m. that Friday before they left for the trip, our nurse was able to train her husband on how to change dressings so that this patient, very respected retired teacher, was able to go enjoy her celebratory trip and still get the plan of care that she deserved.
The Nissus device is powerful yet portable, allowing patients to achieve results while still maintaining mobility. Knowing service is a pain point, we ensure that patients get the customer service they deserve, while clinicians get the support, education, and training they demand.
The last wound care nurse I spoke with, she says she really appreciates the hand deliveries. A lot of times in a pinch, I'll deliver pumps to patients' homes, and when I get there, I go over the pump with the patient so that they understand, when that pump is blinking at them or screaming at them, they understand why the pump's doing what it is. And that ultimately helps, their home health nurse take care of the patient, because, if the patient's only being seen by home health 3 days a week, this other 2 nights they might have an alarm going off and they might panic, and that does happen. So this particular account really appreciates the fact that I do hand deliver these pumps, and I make sure that the patient's comfortable with it and understands how to use it.
Through our growth, through our new partnerships, through our expansion of products, we've been able to add additional resources that really focus in on better care for our patients. At Cork, we continue to look to grow. I'm really excited about the expansion of products, technology, and our staffing. And really our foundation is improving our patients' lives.
Almost every one of our current clients, almost every one of the wound care nurses that currently refer to Cork Medical for negative pressure, they were afraid on that first order too. They had concerns. They had been burnt before. You probably have as well. What they've come to learn and what the feedback they give us is they didn't have to compromise. You can have the service, support, training, education that you want, along with the outcomes you've come to expect. You can have both. Give us an opportunity to prove that to you.